everybody. My name is Tisa Murdoch, and I'm the VMware View Product Line Manager for Healthcare. I'm here today at HIMSS 12 in Las Vegas, Nevada with General Grant from Siemens Medical. Today we're going to be talking to General about how the Siemens Medical solution is able to solve the last mile of EMR delivery. And what we're going to focus on is how we're able to solve the issues around availability, security, and mobility when it comes to a clinical desktop environment. General Grant, welcome.
Thank you, Tisa.
General, how about if you walk us through your point of care solution now and show us how you're actually able to solve some of those key issues that we talked about around security, availability, and mobility?
Certainly. Of course, the number one issue, or the first issue we had to solve was the issue of access, right? So what we've done is enabled it with RFID cards. So they would simply go up to a workstation, they would tap their card on that workstation, enter their PIN to essentially validate that they are the correct user for the PIN. And once they've done that, within a few seconds, their clinical desktop has been provisioned to that user.
So that does a lot to go towards solving the problems of long login times and actually makes that a very streamlined workflow for the clinician, addressing both availability and mobility.
Correct. So, and of course, actually once they're in the desktop, the other thing too is we're saving time just on getting access, okay? So we're saving them on roughly 2.5 minutes just getting to the environment so they can be productive. Of course, the second part of that was to enable single sign-on to the applications so that the users can get to the application point that they need to be as quickly as possible. So with that, as soon as they launch their application, they're automatically authenticated and placed into the application where they belong.
That's great, because we hear time and time again from the clinician that they have to manage passwords, it takes a long time to simply log into a Windows desktop, so you've solved all of those issues with your authentication and this fast access.
Correct.
Excellent. So what about, let's talk a little bit about mobility, because we started to see some of the mobility advantages by simply being able to get to a desktop very quickly. Are you then able to use that same authentication and go from device to device?
Yeah, so actually, to secure the workstation, all we'd simply do again for the clinical user is they would tap their badge and that would secure their session for them. As they roam about the hospital, they could go from from one part of the hospital to another, such as to a nurse's station, or they can actually change buildings within their health system. So to regain access and get back to where they were, they would simply tap their card again on the reader, enter their PIN, and within a few seconds, they are right back where they started, right? So they can continue to work within their applications without any undue delay.
Well, that's great, and I saw that it actually brought your desktop in state, in session, so it preserved that user's session, so they get right back to where they were when they logged off of the first one.
Correct.
And
of course, the other challenge in healthcare is the fact that workstations in high traffic areas, so around a nurse's station or within the patient room, there's a lot of individual users trying to use the same workstation. So the other part of the solution is of high value is the ability to very quickly change from one user to another. So if a second user were to walk up to that same workstation and they tap their badge without even requesting or requiring the first user to log out, they can go and tap their badge and they can get to productive use in the applications they were. And of course, the value of VMware and virtualization in general is that the previous user's session has not been impacted at all. They can now go to a tablet device, a smartphone, or any other workstation in a hospital and continue right where they left off.
well, that's great. And I see on the screen now that you're actually showing some really high-end 3D, looks like a radiology study. So you're able to deliver those through a virtual desktop environment also?
Correct. So a lot of the work that's being done on the floor by physicians is they're using these as reference, right? They use a reading room for diagnostics, but they spend a lot of time on the floor. They want to share information with other users. So the value of us being able to project high-quality imagery to the users allows them to share that information with not only their peers, but also with their patients.
That's fantastic, because that's really where we're trying to get to, is this ability to quickly share information, not only internally, externally, but with patients, so that we can truly get to a connected care environment.
Certainly.
That's fantastic. So again, this is Tisa Murdoch and General Grant from HIMSS 12 in Las Vegas, Nevada. Thank you very much.